I'm Caroline Watson, a social justice and reproductive health intern for HIVE, a hub of positive reproductive and sexual health.
I'm Jenna Request. I am a program liaison with the Center for Student and Public Health, and I'm here with Caroline.
So what are the challenges towards getting adequate health care for trans people?
That is like multi-layered, and it's very dynamic and very convoluted, but I think in terms of access to care for trans folks, a lot of it has to do with different programs and systems that are going to be available to meet the needs, specific needs of trans people. Obviously, trans folks experience a lot of discrimination, violence, trauma, stigma, obviously plays a big role. So you have to really take into account all of those systems and all those issues that play into one's decision into seeking care and being able to advocate for themselves in terms of what their health priorities and health needs are. And relating back to a provider that's really competent and specifically addressing some of the specific trans health related issues.
Okay. And how do you choose your provider?
Myself, I'm in a unique position just because I work in public health and I work within health systems, and so I feel like I am a little bit more aware of the different services out there. But because I do work with trans populations, many of the people that I know who are trans-identified are not aware of different programs and services, and if they are, they're not really specifically geared for trans people in addressing the specific needs, again, of trans folks. For example, when I come in, well, right now I'm with Kaiser Permanente, and so I get annual calls about pap smears, which obviously doesn't really pertain to me, just because it's something that it's not necessary for me at the moment. So it makes a really uncomfortable situation sometimes, and being really able to relate back to my provider and communicating what my other special needs are based on where I'm at with my transition. So again, some systems and some folks really have to advocate for themselves and also establish really good relationships with your provider, and being able to identify and articulate your needs and whatnot. So.
Okay. And what are the health priorities in the trans community?
That's a big question. I think right now, if you ask, particularly for trans folks, it's hormone-related therapy. So, gender transition that may include some medical intervention. So, choosing to be on hormones or not. And depending on where people are, also it can also be getting support around desires for medical interventions, such as cosmetic surgeries related to gender-affirming surgeries, such as either if you're a trans male, maybe you might want to consider a top surgery, or trans females might want to consider having cosmetic surgeries done for breast implants or augmentation, which may also at some point maybe consider sex reassignment surgery down the line. So that's one or two things, but the other things too is just really related to the other things that many trans people experience. Again, stigma, discrimination, relationships, all of that. That relates back to mental health, and sometimes we don't address mental health in a I guess, what do you call it, big picture way, or addressing individuals in terms of what their other health needs are. So really, what I tell providers is really being able to identify with individuals, other things that may contribute to the health outcomes or health needs of folks. So that, and then violence, again, HIV, particularly for trans women, is a major issue. I know that there's a lot of studies have reported about third or 30% prevalence rates for HIV infections among trans people, particularly trans women of color. Suicide, depression, violence, again, plays a big role. More recently, there have been reported suicides of younger trans folks or younger trans kids who, because of bullying or discrimination, choose to commit suicide. And so all that really plays on into your own your own health and well-being. And there's a major gap in really trying to figure out how to address a lot of those issues, particularly for trans folks who experience a lot of discrimination and trauma.
Great, thank you so much.
Thank you.